We tried several medications and it wasn't working anymore, and my migraines started getting closer together. And so Dr. Krause referred me to Dr. Rakes. On the first visit, she knew that I had occipital neuralgia in my neck, which was then causing some of the migraine pain. And we tried several medications and it worked maybe a little bit on the occipital neuralgia. One medication would take my blood pressure up really high, other ones would make me gain weight, others would make me feel out of it.
Susie was one of these patients, like many other people, that medications did not work. We tried multiple preventive medications, say 3 to 7 various medications over months, and they helped take the edge off the headaches, but she continued to have near daily headaches.
My occipital neuralgia was an 8 to a 9, 24 hours a day, 7 days a week. It was very, very painful. And then when I would get the migraines, it felt like, usually on one side, but it would feel like somebody was taking a knife and bending it, over my head, and then stop right behind my eyes.
The migraine patient has the criteria of the headache is usually one-sided, throbbing in character, moderate to severe, and with increased activity, their headache flares. They don't want to do activity, they want to lay in a quiet room. Their headache is associated either with nausea, vomiting, or the bright lights or sounds bother them.
I didn't know anything about Botox. I thought it was just for cosmetic, and I was really surprised when Dr. Rakes told me that that eventually could be an option. And when my migraines were getting worse, I started doing more research on it and finding out that people that were getting as many migraines as I'm getting were maybe cutting the migraines in half. And I thought half of what I'm getting would be unbelievable. The first injection with the Botox, it took the occipital neuralgia completely away, and I was probably getting 1 to 6 migraines during that, maybe even 10 migraines during that first round, which lasts 3 months. And the second time I got the injections, it takes 2 weeks for it to go into effect, but after that 2 weeks, I had no neuralgia and no migraines.
When we talk about Botox, again, we talk about improvement. We don't talk about totally pain-free. We talk about reduction of headaches.
When the Botox started working, I never thought that I would have days, let alone months, without the pain in my neck and the migraines. It was just unbelievable.